right. So I'm Christy Kerner, the COO over at Medplace, and we are excited on our podcast to bring you information that is relevant to risk managers, anyone really tackling the challenges around quality and risk in the healthcare space. Today, I am delighted that we get to have a chat with Adrienne Fugett. She is our VP of Clinical Operations here at Medplace. Interestingly, she was actually one of the very first team members that we brought onto the team because our dedication to kind of really having deep empathy for what goes on in the lives and in the needs of our customers is just of utmost importance to us. And if I'm honest, I don't think we could have found a better person than Adrienne for this because you have quite the background, Adrienne. I am so excited to dive into a little bit of this. So for those that don't know you, I mean, you're kind of a triple threat here. You have spent a lot of years as an actual practicing nurse. Tell us a little bit about a couple of the areas that you were, practicing in.
Yeah, sure. So mainly in the medical ICU. So I took care of patients that were obviously there on a ventilator, any kind of chronic illnesses, chronic heart disease, attempted suicides with medications, really intense, not your everyday kind of medicine. Did a little bit in the ER, but mainly my career centered in, as far as the clinical piece, it's centered around the medical ICU units. And then, of course, I've been on the other side, the administrative side, in risk and quality as well.
Right. Perfect. So you got the, everything coming at you from every direction, which in being that type of nurse really made you have to level up in your understanding of all the different aspects of medicine and how they play together and how you can use this entire network of team members to help patients, right? So you have that. You went into administration around quality and risk. So you have that perspective. And then you also took kind of an especially thorough track to the legal side of things. So tell us a little bit about that.
Yeah. So new in my career, about 4 years into my nursing career at the bedside in the medical ICU, I always had an interest in the legal field. In fact, before I majored in nursing, I had a real interest in the legal field. And what I started seeing in my practice at the bedside is there were a lot of patient complaints that tended to center around a lack of communication. So the complaints medically that I was seeing were not necessarily meritorious as far as the care, but they were typically centered around a lack of communication with the family or with the patient, where the family wasn't really understanding the breadth and depth of the disease process and what was going on with their patient. And so what I was seeing happening was this frustration level build up, right? Because the nurse is at the bedside all the time. So I would see these frustration levels build up and then come to the point of a complaint that would go to the risk department and sometimes even go to legal. And so that became a really interesting path to me. And I decided to get an education in paralegal certification. So there are programs that will prepare you for that. And that's the route that I took. I actually went to a paralegal school. It was 9 months, full-time, post-baccalaureate program, and it was taught by attorneys. So it was Monday through Thursday, 8 to 5. So then I would work on the weekends in the ICU. And it really immersed me in the understanding of just the basic rules of civil procedure, in law in general, basic contract law, all those basics, but it prepared me to be able to speak that language with the attorneys, understand what they needed from me, and then for them to be able to get from me what they needed as well as far as the medical piece.
It's so interesting. So, I mean, you really did dive very deeply across all three parts of this as a practicing nurse, as an administrator in the hospital setting, and then also really being that paralegal that is able to understand now how to bring all of that together. And like you said, it's an interesting note that it was sometimes even just a failure point around communication that can start some of these. So I can understand your passion help this. And, so obviously at Medplace, we are always on a mission to remove friction and to make everyone's lives better in this process of helping people find medical experts for things like case reviews or peer reviews. So
Mhm.
let's dive a little bit into, with the years that you've spent across all parts of that, place yourself for me in the shoes of a risk professional. Okay. What do you wish when you were in that role that you knew, or what advice would you have for them around how do they understand in today's world, oftentimes what they're doing to be able to get that second perspective, that medical expert taking a look at a case review specifically? Let's start with that example. They're reaching out to their law firm because something has escalated. So what's happening beyond the curtain there? I mean, you've seen both sides. So help them understand how their law firms recruit experts and then leverage their insights for cases.
Yeah, that's an excellent question. So in the law firm that specializes in med malpractice, you typically have a registered nurse, not always, but that is the goal and the desire. And that registered nurse is tasked with finding the appropriate expert. That nurse, you can use your own colleagues, your network that you have
Sure.
for you, right? Sometimes you might be in a different practice area, so you find yourself as the nurse paralegal reaching out, doing cold calling, trying to find the appropriate expert to review a case. There's different ways in a law firm that you'll do that, but as you can already imagine, it's time consuming. So you
For
can
sure.
go and look at articles that are related to the particular type of medical issue that you're needing, and you can go into the bibliography, find those physicians that seem like they may be ideal to be able to opine to those issues, and then you start reaching out to them. It's not as quick as you think. Sometimes you get really lucky and you might find someone in 2 or 3 days using that method. Sometimes it can be 2 or 3 weeks. I've worked cases before where we had to partner with co-defendant law firms because we were unable to secure an expert. So we had to pool all of our resources together with the other RN paralegals and try and find them. A lot of these physician experts are extremely busy. When they get a letter or a phone call from a law firm, their initial reaction is they just, hang up. They don't answer, they don't respond. But yet when you're speaking, as you get to know the experts, most of them have a real interest in doing this kind of work. So being able to create an environment, which I think we've done here at Medplace, where you've got practicing physicians coming to the table, so to speak, that want to dip their toe, into the waters, you're already way ahead of the game. So, me, and I'm kind of getting ahead a little bit, but me coming to Medplace, already having that background that I just shared with you, that sometimes you have to search and search and you have to partner with the co-defendant law firm, being able to have this at your fingertips is really more efficient and more practical for getting these reviews done and putting everybody back, back together as best you can from a potential complaint or harm event.
So this is interesting in the fact that, if we just really get down to the actual process side of it, I mean, on one hand, there's never a point in which we are excited about giving our legal team something to do that's going to require tons and tons of time, right? Because that just adds up really fast. They're very specialized in what they do. But like when looking for a medical expert, we really don't want them just Googling who's a neurologist, right? Because the short path to that isn't really necessarily going to get us the quality and the, what you described as the process that you used makes sense that it would be pretty intensive, looking for who are the actual experts, like leaning into the word expert. Who should we really be seeking that second perspective from when we're taking a serious, investment in looking at how did we care for a patient and how can we, do right by them. And so I see your point there, that is a heavy lift for a one-time situation. Which obviously, like you said, was a piece of why Medplace came to be, because we look at that and know that we can create that network of experts that can offer a more efficient level of investment off of, or return off of the investment put in finding those experts.
Yeah, 100%.
And then, I mean, so let's go back in time a little bit here again. So say you do all of that outreach and you spend all of that time, you're probably having to bill the client for that time because there's no other way that that makes sense.
Yeah.
But then, getting the doctor to call you back, like you said, it's not necessarily intuitive for them to know that when the law firm reaches out, this is going to be a really cool thing that they want to jump into.
Right.
So do you find that you usually got like your first, second, third choice all the time, or was it a bit of a mishmash in who you even get to work with?
Yeah, that's an excellent question. And to answer it, no, you didn't always get the first person that you reached out to. Sometimes it took several different experts you had to reach out to in order for you to get someone to call you back. And then you had to discuss the basic findings of the case, see if they're interested, see if they have the time, make sure there's no conflicts. And all of that takes a certain amount of time, like you said, that adds up, as far as
Yeah.
billing to the client.
Did you find yourself having to kind of, if you're reaching out to a doctor and it happens to be their first one, did you find yourself kind of trying to provide some kind of like training or, helping them understand how to think about providing a perspective like this? I mean,
Yeah.
or no?
Yeah. I mean, you did. And what's interesting about that, Christy, is sometimes you would come across an expert that had that experience, and then sometimes you didn't. And then let's say that you get them to review the case and they don't do a great job, or they just don't, it doesn't click for them, or they can't be supportive of the care, which is fine, right? Because that's what you want to
Yeah,
know.
you
Was
want it
there a
unbiased,
deviation?
for
Yeah,
sure.
yeah, exactly. So sometimes you spend all that time and you still don't find the right expert. And again, we're adding time to a process that's already very time intensive as
Yeah,
far as it comes from the law firm. And the training is very limited because we're moving very quickly, because in a
it's
law
fair.
firm, the nurse paralegal has got several cases. Like your caseload as a nurse can be anywhere from 50 to 75 cases at any given time. And of course, they're in different stages, but it's still a big caseload that you still have throughout the day, throughout your month, your week, whatever, where you're still addressing all of these different cases. So it can
Yeah.
stretch out a review into 3 months that really only should be taking a couple of weeks.
Yeah. And actually that's something that we can't overlook the impact of, because certainly we always, have limited resources from a budgetary perspective. So we're mindful of how we are expending those. But back to the whole point here is how are we helping these humans, and delaying something by 3 months when they're already, in an uncomfortable state is never really probably going to help the situation, right? So
Yeah,
that's
it's
an
not
impact
good.
that's beyond financial in a
Yeah,
significant
it
way.
is. It's very being a provider, a healthcare provider, and having that over your shoulders. I mean, I've been on many webinars where you hear physicians talk about that. Having a legal matter over their case affects their practice, their ability to focus. In fact, my ex-husband was a physician and was named in a suit, and so I've lived with it personally, and I've seen how it
Wow,
affects a caregiver. And so you've got that piece on the
it's fair.
physician, right, that's trying to give
Absolutely.
care. And then you've got the patient who feels that they need support, they need help, they've been wronged, there's been negligent care. And so you're just stretching out that entire process for everybody. And at
Yeah,
some point, that rubber band is going to snap and break, right? So
totally. Yeah, no, that makes a lot of sense. I mean, there are innovation is something that will continue to hit every area of life for us as humans, right? But I think it's especially lovely when innovation hits an area that we can really make a difference in the lives of humans. And so
yeah.
let's now fast forward a little bit to what you're doing here at Medplace. So when you think about, all the experience that you've had, what was important to you in how you built out the clinical operations team at Medplace? And how do you feel like that's changing the way that we are able to help this entire ecosystem serve
Yeah.
their
Oh,
patients?
I love that question. Oh, I love it. Okay. So, a couple of things that came to me right away when I met with the CEO, Jared, for the first time. were, my ability to have empathy for the attorneys and the claims consultants, and then my ability to have empathy for the healthcare providers, because I've walked basically in both of those paths. So it was really important to me to be part of creating a company that could effectively provide experts that were going to give you a non-biased view to what was going on with this patient complaint or this harm event, and to be able to do it in a way that had a decent time frame around it, right? So, 3 days, 3 weeks versus 3 months, that sort of thing. That was hugely important to me. And then being able to provide an opportunity for healthcare providers to monetize their expertise away from their bedside. Because I will tell you one little thing that we haven't touched on that I think is important is everybody in healthcare, physicians, nurses, people giving care, we tend to burn out a lot quicker now, right? So when I first started as a nurse, a seasoned nurse was considered 8 to 10 years. A seasoned nurse now is 2 years. And so people in healthcare are burning out much more quickly. And that has a potential negative effect for all of us, right? Because if we lose experienced physicians and nurses, that affects the kind of care that we receive as patients. So being able to provide this opportunity at Medplace where you can monetize your expertise away from the bedside and be so excited about your expertise and the care that you give, so that when you go back to give care, you're like, oh my gosh, this is so interesting. I'm taking what I'm learning from these cases and I'm applying it to the care that I give now, and I'm helping my peers and my colleagues. All of that, Christy, just came together for me like this just aha, wonderful moment. So I'm very passionate about answering the questions and the call, for the claims consultants and the attorneys. How can I help you? How can I make this better? And then also preparing a work environment that has good pay and good respect for your expertise as a healthcare provider. And I just think being able to meld those two things together, it can make medicine better. And I hear experts talk about that. I've heard nurses tell me, this has changed how I give care. I've heard physicians tell me, this changes how I give care. It makes it better.
That's awesome.
So,
that's some real impact, and it's really terrific. I mean, we have a unique opportunity to contribute in a way that we really sincerely aim to improve healthcare. So, well, Adrienne, thanks for spending a few minutes with me today. I'm sure we'll get a chance to dive into some other topics over time, but if any of our audience that are thinking about how to improve their processes around it, either from a legal firm, from being a risk management professional, or a doctor that's interested in being a part of a network like this and being one of helping us serve on our mission to find better doctors and give better insights, they can reach out to you, can't they?
Yes. Yep.
All
Anytime.
Right. Perfect. All right. Well, thank you, Adrienne.
Absolutely. That was fun. Thanks so much.